Good morning, everybody. This is Saturday, May 16th, and I have a special guest with me today. Oh, let me introduce myself. I almost forgot. You can tell I'm not quite awake. I am Betsy Wurzel, host of Chatting with Betsy at Passion World Talk Radio. Jeanne White is the producer, and Jeanne writes the blog. Please listen to the show. Please read the blog and share it, and share the show. It's very important. I have a very special guest with me today. Get your paper, get your pen, because when Sue Fernandez comes on, you need to be writing down this information. And Sue has a special show today of, I call it breaking news. So please pull up a chair, get your beverage, and listen. Welcome, Sue. Thank you for coming
Betsy.
on.
Hello.
Hi,
how are you
Sue.
doing this morning?
I'm okay. A little off. Forgot to introduce myself.
Well, if you recall, we got our lines crossed as far as the time goes because there's a 3 hours difference, and I was laughing, running around. So we don't know who's on first this morning. So, Betsy, thank you. I appreciate you allowing me to talk about this. Again, it's breaking news. I call it a red alert, and it's not only for caregivers, it's for everyone. And I'll explain once we talk about it. A couple of weeks ago, I was reviewing my emails, and I'm also I belong to the Canner, not belong, but I'm a, what would you say? Oh, my gosh. I'm very familiar with Canner and what they do, and what Canner stands for is California Nursing Home Reform, and they're a nonprofit here locally. In Northern California. But anyways, they had a very interesting and shocking press conference that they held on April 20th by their executive director, Pat McGinnis. And I was so angry and frustrated. And as I mentioned, it's for everyone. It's just not for the elderly in homes or the disabled in homes. What they focused on was what happened on April 9th. The healthcare industry, which includes the residential care assisted living industry, hospital association, and medical association. They lobbied and wrote a request to the governor asking him to grant immunity to all acts, including administrative, civil, criminal liability resulting from this crisis, the pandemic. Personally, and this is my opinion, it's just an excuse for elder abuse, including financial abuse. One of the many problems they have thus far is that residents have no rights. And I'm talking about the pandemic right now. I'm not talking about any other time. They have no rights. Staffing requirements have been suspended, meaning if they need to go add on more staffing, that's been suspended. Long-term care ombudsmen cannot visit. They are not allowed to have visitors. Even the health care inspectors are not visiting these facilities. Now, once I read that, I really got hot and upset and furious. So what I did is I called locally, and come to find out, and again, I'm in California. Every state is different. I called locally, and thank God there is someone out there on the phone answering and taking phone calls. So that was comforting to me in California, but in another state, cross your T's and dot your I's, because I don't know how it's going there. There's a lot of changes going on. Again, like I said, several problems they have is that residents have no rights, staffing requirements have been set up, suspended, etc. In addition to this press conference, the executive director, and she had three attorneys there that represent them with Canner. There was also an AARP advocacy director and an executive director by the name of Jessica Lehman. In addition, there were a couple of reporters there, and they had asked a couple of questions. But I just wanted the caregivers, their loved ones, and everyone to know about this. I checked out the website. I'm also on their website for the Center for Medicare Advocacy Alert. And a number, what I'm reading from is from their website. So these aren't my words. This is exact to the point. This is from the Center for Medicare Advocacy Alert. It's their website. A number of governors have issued executive orders giving broad civil amenity to healthcare providers for acts and omissions, injuries, and deaths during the pandemic, except generally for willful misconduct, gross negligence, or actual malice. The executive orders, meaning the president, typically also recite that the lack of resources or staff does not constitute willful misconduct or gross negligence. Let me repeat that. The executive orders typically also recite that the lack of resources or staff does not constitute willful misconduct or gross negligence. State legislatures also have enacted legislation to grant immunity to nursing facilities, among others. Executive orders and declarations have been issued in Arizona, Arkansas, Connecticut, Georgia, Illinois, Indiana, Kansas, Michigan, Mississippi, Nevada, New Jersey, Pennsylvania, Rhode Island, Vermont, and Virginia. Now that's upon the presidential orders, the executive orders.
Wow.
State laws giving immunity to nursing facilities, among others, have been enacted in Kentucky, Massachusetts, New Jersey, New York, and Utah. That's the governors. So it's just shocking that they want to do this and that they've already enacted it. So let me take this a step further, Betsy, and let's discuss this.
Mm-hmm.
Let's say this pandemic is going on for another 2 or 3 years, right? And I'm driving my car, and I get in a horrible accident, and I break both of my legs. So because I don't have any care at home, I have to go to a skilled nursing facility for, I think, the norm, depending on how bad my broken legs are, let's say 3 to 6 months. So I'm in the skilled nursing facility for rehab. Again, I'm there for rehab. I'm not there because I'm a dementia patient or anything of that sort. So I'm in there for rehab, and they're helping me go to the bathroom, and guess what? They leave me there for an hour, and I try to get up to open the door, and I fall. And let's say I hit my head, and something happens to me. So my question is a normal person covered in this pandemic or not? I don't think so. It's just a chance for the nursing facilities, the medical association, and as I mentioned also, the hospital association, to put a Band-Aid on it because of their neglect. In addition, if you noticed, they said that lack of resources or staff does not constitute willful misconduct or gross negligence. I don't know what they're talking about with regards to that. It's just confusing and just really upsetting. Another email I read, Betsy, was from the Center for Medicare and Medical Services. And this is from them, from their website. Announced it will require nursing homes to tell residents and their families or representatives within 12 hours if a COVID-19 case is confirmed on site. The information must be reported to the CDC. Some states, including Michigan, Illinois, New Jersey, California, and Florida, have announced plans to name nursing homes with cases, but not all states are doing so. So that is a recent change from the Centers for Medicare and Medicaid Services. So they're required to tell residents and their families or representatives within 20 hours if a COVID case is confirmed on site, which is good. I think that's a positive thing. It also says, don't be shy, and again, I repeat, don't be shy about contacting the nursing home to ask if it has cases and deaths about what protective measures they're taking. If the facility is not forthcoming or if you have a concern or complaint, contact your state long-term care ombudsman. So, unfortunately, the burden is on us as caregivers and advocates. So now we have to challenge and advocate even more while their loved ones are in the facility. It's just horrible because that includes everybody. That includes everybody during this pandemic. Let me provide your listeners a definition of the Ombudsman program. What they do, ombudsmen make monthly, unannounced visits to each licensed facility. The principal function of the Ombudsman program is to work to resolve complaints made by or behalf of long-term care residents. Ombudsmen respect resident and complaint confidentiality while focusing the complaint resolution to the resident's stated wishes. Ombudsmen also investigate claims of alleged elder abuse occurring in licensed facilities. All Ombudsman program work in a resident-driven, including any collaboration with state licensing and other regulatory agencies. The primary purpose of the Ombudsman program is to support residents' rights and to help achieve the best possible quality of life for all long-term care residents. Staff and volunteer ombudsmen provide assistance with the following: quality of life issues, quality of care issues, resident rights violation, suspected abuse investigation, formation of residential councils, in-service training and education, consultations to individuals and families, witnessing of advanced health care directors, and community outreach and education. As I mentioned, I contacted our local ombudsman, Betsy, and we were fortunate someone answered the phone. They also have a hotline crisis number for you to call. So if anybody has any issues regarding their loved ones in a facility, call them, and they do have a crisis hotline for them. The only thing that I could think of right now, and I do have to look into it more, and anybody else is welcome to do that, if no response, contact your state public health department, as they are the ones who have oversight on these facilities. Again, contact your state representative. That's another option. You have to rattle and shake someone's tail in order to get something done. Let's see here. This is
that's great information, Sue.
Yeah, what I wanted to read, it's horrible. It's what I wanted to read, too, and this is from the secretary, Azar, and he wrote, this is his report to the president. For healthcare professionals to feel comfortable in expanded capacities on the front lines of the COVID-19 emergency, it is imperative that they feel shielded from medical or tort liability. He continued, given variation in the scope of these state laws, it is particularly important for states to issue guidance publicly outlining the available liability protections during the COVID-19 in an emergency. And that's it, Betsy. I hate to be the bearer of bad news that we have to speak up more, be more active for our loved ones in the facilities.
Yes, and you know what? That's a dilemma nowadays, Sue, because they don't let people visit. So nobody knows what's going on in a facility with their loved one because they can't see them. I mean, they could FaceTime them, but when they do, it's at a scheduled time. They just can't pop in anymore to see what's going on. So that is kind of scary because you don't know what's going on. We know they're short-staffed to begin with. That's always been the case. And then you add COVID-19, and they're really severely short.
Even more.
Yes. Here in New Jersey, there was and still is a huge problem with staff shortage.
Right.
The residents getting the virus, families not being told. Even in the VA hospitals, VA homes, the National Guard came in to VA hospitals, homes with dash, and nursing facilities now. I mean, it's really a crisis here in New Jersey. So as you're listening, no matter where you are, contact these people that Sue mentioned. You can look it up. You could Google them.
Right.
You can.
I will give you the website.
Look it up in your phone book.
Sure, it's www.canhr.org, and they have the press conference there that you can listen to, write your notes. And again, this is for California, but as I just read, it's throughout the United States. The other website is for the CMS, Center for Medicare and Medicaid Services. I belong to their newsletter, and I receive tips and things like that going on. So it's not just me blabbing. Do your research, and you're going to have to scream at the top of your lungs and go over the ombudsman's heads as well as public health department's heads and complain to your representative. It's just sad, Betsy. Like I said, they should check out the articles by Canner, and you could even call them. One tip I wanted, this is off the subject, Betsy, but I wanted to offer one tip. I was listening to a Susie Orman podcast, very well-known financial advisor, and if you have a student loan, they're offering no payments until September. What they're going to do is they're going to add those payments at the back of your loan anniversary when it comes due. So if your anniversary is 2021, it'll be not December, it'll be, I'd say 4 months, it'll be April. It'll be April. So that's a good thing. That'll save people some money. Like I said, they're offering a no payment until September. They need to contact their student loan advisor. One last thing I wanted to mention. Betsy, we have to put a shout-out to our friend and partner in crime, James Hamilton. He's a certified dementia practitioner. He has his own Facebook page called Dementia Family, Friends, and Caregivers. I'm a admin there for him on his website, on his Facebook. And thank you, James, for allowing us to share your educational information to our listeners, to our Facebook pages, and more. He also has a very great sense of humor, of which I enjoy chatting with over Facebook. Thank you, James, for sharing.
Yes, thank you, James Hamilton. And I want to tell the audience, please check out that Facebook group. It is for people who have dementia, those who don't. I don't have dementia. I don't have a family member anymore with dementia. I'm still in that group. I'm still learning. And I share that information. James is so gracious. And my own group, #Kick Alzheimer's Ass Movement. This is what it's about, people. It's helping each other and sharing information. So I'm going to go back to what you discussed, because there's a lot of information that needs to be absorbed. So you mean to tell me, I want to make sure that I understand this right myself.
Oh, sure.
If I have a loved one in a facility now, just suppose, hypothetically, I have a loved one in a facility, and I wouldn't know if they're getting taken care of properly. But if they call me and tell me that, just say Matt is in there, and they said, okay, Mrs. Sloan, that's my married name, Miss Sloan, Matt fell. He's okay, but we're sending him to the emergency room just to make sure. I know I can't go to the emergency room, and I can't even check to see if it was negligence then.
That's it. That's the whole point.
Why he fell. That's really serious stuff, Sue.
And on
that's
top of
scary.
that, because I've mentioned to your listeners, I'm on several other Facebook pages for people with Alzheimer's, Betsy, and I'll be darned. When I made this brief announcement on another website, and sure enough, there was a Facebook friend on there, and she mentioned that her loved one fell. They didn't report it until 6 days later.
Oh my
How bad
goodness.
is that?
That's
so
bad.
It's it's sad, and I know not all of them are that way. I know my mom was in a large facility, and my mom was in a residential care facility, basically meaning she was in a home, a large home that had like about 4 bedrooms, and they converted them into rooms for people of 2. And there are, like I said, there are good facilities. But what I hate to mention it, and I'm going to be the bearer of bad news, and I'm embarrassed to say this, Betsy, in that press conference, they were asked, all the facilities were asked to do a report on how many people they have there, if they have any with COVID, right? Well, one of the reporters, and I didn't catch his name, he said that Fresno County, where I live, and Kern County is like in the Bakersfield area, and that's about an hour and a half south of where I live, they did not do any reports. Why? And we have a ton of facilities here in Fresno. Again, like I said, I'm embarrassed and ashamed.
Wow. That was a problem in the beginning of this pandemic here in New Jersey. They weren't reporting it. They weren't taking it seriously. There have been, I just read this week in the paper, my local paper, of residents dying in the local VA home, not too far from where I live. They complained about symptoms, and the staff didn't listen to the family members. They shoo-shooed it. Oh, well, we had no one to test positive, but were they doing testing at that time? They might not have been doing the testing at that time.
I don't think so. I'll be honest with you. My thought is they weren't testing the homes. They weren't testing the homes. You and I can't get a test, so a disabled individual in the home, how are they supposed to get tested unless the caregiver speaks on their behalf?
That's right. And these, unfortunately, these people passed away from the COVID. And they were mixing COVID patients with patients that were well. And staff members have died from the COVID, as well as residents. There was a nursing home in my township that closed down. They sent their residents up to another nursing care facility in New Jersey. Now they cleaned it out. It's opened back up, but they had a lot of, I forgot the last count, they had a lot of residents that passed away. I mean, they were elderly, they were fragile, and they're the ones that are at risk. But, you know, I want to tell the listeners, this pandemic is no joke. This is serious, people. Very serious. And it's not going to just go away. We need to be cautious and follow safety. It really is a matter of life and death. Really wearing a mask, protecting
Betsy,
yourself.
If I can interject for a second, and if you stop and think about it, I know very well here in the Valley there are a lot of low-income people, and a lot of them they're certified CNAs, and they don't make enough money for their family. So what they do, they go, what would you do? You go and get another job at another facility, right?
Right. That's right.
So you have one CNA, God bless their heart, working at a facility for 6-8 hours, and then to make up more money because they have to feed their family, they go to another facility, and they could be asymptomatic. So that's how
right.
I think a lot of it happens, too. And it doesn't have to be CNAs. It could be nurses.
Nurses,
it could be a doctor.
Yes. And they didn't have the equipment, and they don't have enough of the personal protection equipment. Nurses are asked, I heard this on a show that Jeanne White did with Sheila Wilson and another nurse up in Massachusetts. the nurses don't have enough of personal equipment. And this is in a hospital, people. I mean, to bleach a mask or put disinfectant on it, and then you're breathing those fumes, I think I would be gagging.
Right.
How safe is that? We really need to take this pandemic seriously, and this pandemic is affecting every area of our life. And if you have a loved one who is at risk, or you yourself, the caregiver, is at risk, it makes your job even harder. And there's just no question about that. It does. And it's very interesting. We're talking about when someone is sent out. My mother-in-law, Matt's mom, was in a county nursing home, which has now closed, the big part. We were called. As soon as it happened, we were called. They were very good about that. And, excuse me, we know they're short-staffed. Maybe that's why they weren't called, but to wait 6 days, that's just unacceptable.
Too, Betsy, if I've been following the story about being understaffed with the different facilities, I've witnessed it. People have told me that when I was a counselor for AARP, they would tell me different things. Again, that's on the low-income edge, and they would come looking for a job, so I tried to place them out of the medical field. They told me they are understaffed. And you know why they're understaffed? So they don't have so they save that money. It's all about money in their own pocket. It is what it is. It's about money. And it's sad. You're jeopardizing a human person's life.
Yes. It has always, I could say, and I know this for a fact, it has always been short-staffed. I'm 62 years old. When I was 16 and 17, I worked as a nurse's aide in a nursing home. Back in 1974, 1975, I had 16 patients to wash and get up.
Oh, wow.
And there was one nurse in the building.
Is that right?
Yes, and I remember that. And, I mean, you're going back over 40 years. Oh, I'm old. but it was severely short-staffed. And it's probably improved, but even when my dad was in a facility down in South Jersey, he had good care, but they were short-staffed always. And now with this, COVID and the staff were getting ill.
Well, and on this,
I could just imagine
them granting them an immunity. Betsy, they specifically say that it's not. Here it goes. It says. Okay. Oh, darn it! I can't find it. But they're saying it's not willful misconduct if there's a lack of staff. Well, how does that doesn't make sense to me. Does it to you?
No, not at all. Excuse me, not at all. So you mean to tell me, Sue, that if they're saying that if someone has fallen, somebody gets hurt by another client, another resident, or they come down with COVID, that the nursing facility is not responsible. In other words, they're washing their hands.
Exactly.
Of any fault.
Now, on their defense, they're supposed to provide guidelines of what they think or whatever. But I'm sorry, Betsy, I don't trust a lot of medical facilities. They do that. They know how to, erase their reports and things of that sort, backdate it. They know all the tricks. They know all the games. And I hate to be negative because, like I said, we were blessed with, a couple of facilities my mom was in that they were very good. But again, I had to challenge them. I had to challenge them. I had to go over their head, and I contacted the community licensing. But see, that's because I was walking in there, and they were trying to prohibit me from seeing my mom. and this was before the pandemic, and they cannot do that. The only way they can prevent you from seeing your loved one in the facility is if they have a restraining order on you and or you were found guilty of some sort for financial abuse. And they had neither of that on me. But they still told me, the administrator of the residential care facility still told me I couldn't visit Mom. And as I mentioned, I blew up, and I just said, you know what? I told her on the phone, because she wasn't there at the time that I was going to take my mom out. I says, I'm taking her anyways. I says, I asked you 4 months ago, and you said it was fine. And so, I took her out to lunch, brought her home, and like I said, I was fuming. I was fuming all the way home. I had to come home because I knew I was going to go postal. But I came home and I looked into it, and I found out that community licensing oversees the nursing facilities. And they told me the law. They laid down the law, what they can and can't do. And my sister and the facility cannot prevent me from seeing my mom or taking her out. I know, and to backtrack a little, the other thing was that if Mom really physically, even though she had dementia, if she verbally said, no, I don't want to go out to eat with you, no, and the facility, heard the conversation, that was another option. Because even though they have dementia, they still have rights. They still have rights.
Yes, they do. I worked as a nurse, and in the hospital, and I'm going back like 36 years, and if a patient didn't want a medication, I couldn't make them take it. They didn't want their blood pressure checked. Can't make them take it or do it. You have to ask someone permission. Mm-hmm. And a patient has a right to question what you're giving them, and they have that right. They have a right to question a doctor. And Sue, as you know, because we talked about this, I'm going to be doing a series about being an advocate.
Okay, great.
And you're, one of the speakers who are going to come on, and we'll give a little tease here. People might ask, well, how does someone become an advocate? I'm too shy, I'm too quiet. If you are a caregiver, you are being an advocate. You're speaking up for your loved one. And if you're not speaking up for your loved one, when you see an injustice being done and you don't think something is right, then you need to step into that role for your loved one.
Right, definitely, Betsy.
Well, Sue, that was great information, a little scary, when you think about that.
But
that's
again,
really...
You have to put it out there so the caregivers, the advocates need to know what they're up against. And like I said, the last thing is, if the ombudsman don't answer or can't help you, go with your gut instincts, contact the public health department, go on top of their head, contact your state representative. They need to know what's happening. You have to, in addition, one last thing, Betsy, if they do that, if they take those steps, have them write down who they spoke to. Take extensive notes, and that will help you immensely. Extensive notes.
Yes, good idea. Who you talk to.
It's a journey no one's going through.
Right. This is really a different, time that we're in. But whenever you do speak to someone, take their name, take their number, write down what you talked about, because, everything leads to a paper trail.
Exactly.
And even on computer, there's a trail. And that was very informative, Sue. Thank you very much for sharing this news.
Betsy.
It's really, when you think about it, they're just saying we're not liable. We're not going to be liable for anything.
They can do whatever they want to whomever they want, and it's all during this pandemic.
It's mind-blowing.
Right.
Very mind-blowing.
Thank you, Betsy.
You're welcome. You're welcome. And another thing you mentioned, Sue, and it's true because I've worked with people who worked in 2 different places.
Mm-hmm.
So if they are working in one facility and they have 2 jobs, they're working in another one, they could be carrying, transferring germs back and forth.
Right.
That's a good point. Very good point.
Right.
Well, I appreciate you coming on this Saturday morning, Sue. Thank you always for your information. And if you missed any of this audio cast, you can catch Chatting with Betsy on Spotify, Spreaker, iHeartRadio, Podchaser. Look up Chatting with Betsy and subscribe, and that way you will get to hear my audios. And when Sue Fernandez comes on, I'm telling you, I used to, when you talked with Jeannie, I would grab my paper, grab my pen, and I would start writing down what you were saying, and then I would listen to it over again and make sure I didn't miss anything, because Sue, you give such valuable information, important information. I appreciate you coming on and sharing your knowledge with us.
Sure.
Thank you.
Sure.
Thank you very much. You're welcome. Well, folks, till we chat again, this is Betsy Wurzel, host of Chatting with Betsy. Not am I just a host, I'm also an advocate, and I will speak about the taboo. So if you want me to discuss a specific taboo subject, you can contact me. You can follow me on my own Facebook page, Betsy Wurzel, Wurzel. I have my own group, #Kick Alzheimer's Ass Movement. If you have someone with dementia, if you don't, and you just want to educate yourself, then please join my group. Join James Hamilton's group. What's the name of that group again, Sue?
Sure,
Dementia Family.
Friends and Caregivers.
Friends and Caregivers. Check out that group, too. I'm in that group. James and Sue are in my group. You know, you can belong to more than one group, folks, and I encourage that. I encourage any caregiver, or even if you're not a caregiver, I'm not a caregiver anymore to someone who has dementia, but I still want to learn. Join groups, get information. It's a great way to have knowledge. You're free. And it's free, folks. Webinars. The Dementia Spotlight Foundation, free webinars. This is how you learn this information, and it's valuable. I wished that there was these webinars back in my day of caregiving. Believe me, I wished there was. And, you know, it's good to hear people who have dementia speak on what they are going through. That's how we learn. Folks, if you have dementia yourself, come on my show. Tell people what you're going through. We want to hear from you. When people come on my show, I want them to feel comfortable. Speak your truth. You just can't use foul language. Other than that, speak your truth. I don't want someone coming on that's going to be afraid to speak their truth. I say spill your guts. Okay, I'm from New Jersey. Just spill it. And say what you have to say, because people need to hear. I wish my husband would have talked about what he was going through, but he didn't. But I really appreciate so much when people with dementia talk about what they are experiencing, because it does help us. It helps the caregiver. And, you know, these are important topics to talk about. So I advocate for, mental health issues and any other topic or issue. There's great shows coming on. I want to encourage people to listen. And please share the blog, share the audio cast. You're helping somebody. And, when you withhold information, it's kind of being selfish. So share. And share your experience. You don't know who you could help. You really don't. You don't know who hears you. So please share your information. And I want to thank Jeanne White. I want to thank Lillian Caldwell, who started this radio station, Passion World Talk Radio, that gives people an opportunity to talk. And I would really take advantage of the opportunity. I definitely would. I was so happy, and it'll be 2 years next month, and I met Jeanne White. And I can't tell you how much Jeanne White changed my life, but that's time for another show, the anniversary. So stay safe, people. Wear your mask, wear your gloves, and just stay safe. And God bless all you first responders, nurses, doctors. And I want to put a shout out next weekend. Can't believe it. Memorial Weekend. I want to say thank you for the men and women who they sacrificed their lives so that we can talk on the radio, so we can go out and vote. Thank you to the men and women who died protecting our country. And I want to throw out a salute. Memorial Day, we remembered the ones who died for us. People get confused. The Veterans Day, we remember the living veterans. So with this Memorial Day, stop and think about the veterans, men and women who died protecting this country so we can have rights. So thank you, everybody. Again, this is Betsy Wurzel, host of Chatting with Betsy. Till I chat again, bye-bye.